How does D-Mannose help prevent UTIs for bladder health? Imagine a tiny molecule that could help keep your bladder healthy by stopping bacteria from causing infections. That molecule is D-Mannose, a simple sugar that has gained attention for its potential role in preventing urinary tract infections. When bacteria like Escherichia coli, which are the main culprits in most UTIs, enter the urinary tract, they use tiny hair-like structures called fimbriae to stick to the lining of the bladder. These fimbriae latch onto mannose residues on the bladder cells, helping bacteria stay put and multiply. D-Mannose works by acting as a decoy. It binds to these fimbriae in the urine, preventing bacteria from attaching to the bladder wall. This means bacteria are less able to colonize and cause infection, and they can be flushed out more easily during urination. Research on D-Mannose for preventing UTIs has shown mixed results but some promising signs. Several studies and reviews suggest that taking D-Mannose might reduce the chances of recurrent UTIs, especially in women who experience frequent infections. Some trials have found that women using D-Mannose had a longer time before their next infection and a lower risk of getting another UTI compared to those taking a placebo or antibiotics. D-Mannose is generally well tolerated, with minimal side effects like occasional diarrhea, making it a safer alternative for some people. Because of this, it is considered a potential non-antibiotic option to support bladder health and reduce infection recurrence. However, recent larger studies have shown that D-Mannose may not be effective for everyone. Some high-quality trials found no significant difference between D-Mannose and placebo in preventing recurrent UTIs. This suggests that while D-Mannose might help some individuals, especially those with mild or infrequent infections, it may not be reliable for everyone, particularly for postmenopausal women or those with more complex bladder conditions. It is important to remember that D-Mannose should not replace standard medical treatments like antibiotics when an infection is present. From a bladder health perspective, preventing UTIs is crucial because repeated infections can cause ongoing bladder inflammation. Chronic inflammation might irritate the bladder lining and, over time, could contribute to more serious bladder problems, including bladder cancer. Using D-Mannose as part of a broader approach to bladder health could be helpful, but it should always be used under medical supervision. Consulting a healthcare professional is essential, especially if you have frequent UTIs or other bladder issues, to ensure you get the right diagnosis and treatment. In summary, D-Mannose helps prevent UTIs mainly by blocking bacteria from attaching to the bladder lining. It can reduce infection risk and support overall bladder health, especially in people prone to recurrent UTIs. While some research shows it may be as effective as antibiotics with fewer side effects, recent studies suggest it might not work for everyone. It is a safe supplement for many, but it should be used alongside medical advice and not as a substitute for proven treatments. Always talk to your healthcare provider to find the best plan for your bladder health and infection prevention.